Hello, my name is Janet North, and I'm a consultant with Eden 2, a nonprofit public health organization. Today, I'm here to take you on a community assessment journey of the Midtown Edmondson community by way of the Sandtown Winchester Harlem Park community. The Midtown Edmondson community, or MAC for short, is a historic district in which the development of residential row houses were built largely from the 1900s through the 1940s around the Edmondson Avenue streetcar line. The community ranges from street and walk-up resident row homes to mixed businesses and industrial warehouses with a massive amount of vacant buildings and lots that are heavily peppered in between within the 21216, 21217, and 21223 zip codes. This area is historically significant for the growth of West Baltimore and its overtones of the racial transition of West Baltimore. MAC was chosen for this community assessment for its rich historical heritage, its current state of desolation, its potential for revitalization, and its rate of health outcomes compared to those of Baltimore City. With all the health outcomes that outranked Baltimore City at the time, the focus of this assessment will be on the rate of HIV/AIDS deaths, since it is more than 3 times the rate of deaths in Baltimore City overall, and some of the socioeconomic factors that may impact the health status of the community, such as disinvestment causing a devaluing of the properties and concentrated poverty, the location and isolation of the community, illegal drug trafficking along with drug and alcohol use, and the lack of resources. It is because of the anticipated complexity of this community assessment that the methodology used for the assessment and intervention planning program is a hybrid of the Mobilizing for Action through Planning and Partnerships MAP and Pre-Seed/Proceed PPM models. The MAP and PPM models are similar in the manner that they both focus on health interventions from the community perspective, but can be adapted to address other community issues as well. The models emphasize community and various stakeholder partnerships. This concept is useful to develop a successful process that progresses from the community-generated vision with well-established strategies and goals based on prioritized assessments to implementation, evaluation, and re-evaluation. Since the focus at the time is only on community assessment, the MAP model was determined to be the better choice. However, in the likely event that the selected community chooses to continue with the planning, development, implementation, and evaluation of the intervention program, the MAP assessment could easily be incorporated into the PPM for a more vigorous design. The Mobilizing for Action through Planning and Partnerships consists of 7 underlying principles, which are crucial to the success of the implementation phase of MAP in the community, and 6 phases that provide the framework for the MAP process. The underlying principles are systems thinking, dialogue, shared vision, data, partnership and collaboration, strategic thinking, and celebration of successes. For the purpose of Midtown Edmondson Community Assessment, only Phase 3 will be examined. The preliminary assessment was conducted via literature review, windshielding, visual observations, and interviews. Both rich in historical milestones and drenched in racial tensions, Baltimore played a key role as the center for maritime and rail trade. This epicenter consisted of diverse neighborhoods, making it a thriving multicultural city in its early history. However, as white Baltimoreans began to dominate the more centralized communities, neighborhood segregation grew, and racism began to plague the political, economic, and social policies of Baltimore and continued throughout the 20th century. After World War II, the white-black dividing line began to blur as middle-class African Americans began to move into Midtown Edmondson, resulting in the exodus of white Americans. To ensure that the divide was significant enough, Midtown Edmondson whites leapfrogged several neighboring communities and migrated into the county, which brought about one of the earliest cases of blockbusting. Midtown Edmondson and neighboring communities went from all white middle class to all black middle class in as little as 1 year, from 1949 to 1950, which leads us to the current boundaries and demographics of today. The Midtown Edmondson community, as illustrated by the City of Baltimore, is located just west of Central Baltimore City, which is constrained on the western end by North Bentlow and on the eastern end by North Monroe. The northern borders run adjacent to CSX train tracks and West Lafayette Avenue. and the southern borders run along West Mulberry Street, bounded by the MARC train. The boundaries of Midtown Edmondson overlap into several census tracts, 1605, 2001, and 2002, with 1604 being the most central. In addition to overlapping census tracts, MEC has overlapping geographic boundaries with Sandtown, Winchester, and Harlem Park communities, or SWHP, and therefore the data used will reference mostly the Sandtown, Winchester, and Harlem Park communities unless otherwise stated, as you see here. Income, housing, education, and other amenities will be helpful in identifying the correlations between socioeconomic indicators and the planning, implementing, and achievement of successful health goals. But a holistic assessment of the MEC cannot be thoroughly understood without identifying and considering the impact systemic discrimination has had, first on a larger scale in the Baltimore City and then on a smaller scale this community. In addition to the block busting, legislation was enacted in 1910 which promoted the racial segregation of neighborhoods, allowing housing developments and communities to set up restrictive covenants, some still in existence today, which prohibit the admittance of Jews and blacks. The creation of the Federal Housing Administration of 1934, with the sole mission being to promote homeownership by ensuring private mortgages, openly supported these discriminatory covenants. This process is more commonly known as redlining, and the effects of it are felt in this community even still to date via community disinvestment, causing a devaluing of the properties and a concentrated poverty as reflected by the median household income for MEC as recorded in 2012 as approximately $24,000, with the average household income falling 51% below the U.S. average. The New York Times suggests that the acceleration of the urban decline and ghettoization preventing generations of blacks from acquiring wealth in Baltimore is due largely in part to this system, which trapped African American families in dangerous and dilapidated communities even still today. Some of these communities sit in isolation amidst bustling surrounding neighborhoods, waiting for support to trickle down to them. Midtown Edmondson community is one such community. Location, location, location is everything, especially to a community that is isolated due to poorly planned and discriminative development. The Midtown Edmondson community began to experience social upheaval in 1968 when many of the buildings were destroyed during the Martin Luther King riots. Following that turbulent period, the 70s brought about the construction of the Road to Nowhere, or R2N, which further decimated West Baltimore neighborhoods and severed their connections to neighborhoods to the south. The birth of this incomplete city planning project formed in the mind of Robert Moses as a way of ridding the city of African Americans. He supposedly made the statement, "The more of them that are wiped out, the healthier Baltimore will be in the long run." Well, for the Midtown Edmondson community and so many others, he was dead wrong. As of 2010, the vacancy rate for Midtown Edmondson went up 50%. Of the 1,727 total housing units in the area, 862 are occupied, while 865 lie vacant. Even still, members of the community continue to fight to get funding funneled into the area to breathe a life back into this once thriving community. It was thought that the Red Line, an attempt to complete the connecting roadways of the R2N, would offer a glimmer of hope, as this line promised to insert the final piece of the puzzle, which would connect neighborhoods east and west of central Baltimore City. Unfortunately, with much debate and pullback by the current governor Larry Hogan, those hopes were dashed in 2014 when he opted to cancel the Red Line. All of these factors have resulted in several decades of population loss, community disinvestment, and the lack of developer attention, leaving the community vulnerable to the trafficking of illegal drugs and an increased crime rate in MEC, resulting in undesired health outcomes. The reason the focus is on HIV/AIDS is to explore why HIV/AIDS mortality rate is increasing in this community at 3 times the rate than the entire city of Baltimore. The CDC states that the rate of HIV diagnosis is disproportionate across the United States. However, in most diagnosed cases, individuals reside within urban areas, much like SWHP. The CDC data further reveals that lifetime risk of HIV diagnosis per state distribution is highest in the District of Columbia at a rate of 1 in 13, followed by Maryland at a rate of 1 in 49. And the ethnic groups which are at a higher risk are Hispanics on the West Coast and African Americans overall throughout the country. A brief stroll through many of the SWHP communities would prove that they have and continue to be ravaged by the effects of the drug epidemic. For the purpose of surveillance, the CDC has categorized a hierarchy of exposure for HIV. The first being MSM, standing for men who have sex with men. That includes homosexual and bisexual men. Number 2 is IDU, which is injection drug use, and that's for men or women who report that they have received either a self-administered or assisted injection on an unprescribed illicit drug. Number 3 would be MSM and IDU. Number 4 would be HET, heterosexual exposure. That's men or women who have had sex with someone with the opposite sex that is exposed at high risk or HIV infected. Number 5 is perinatal exposure, and that's any baby born to a HIV positive mother. The population most at risk is all too clear, and as you can see, the group with the highest percentage of exposure in multiple categories are African American men and women. In the males, MSM and MSM-IDU categories at 27.7%, IDU at 15.6%, HET at 8.6%, and in females, HET at 19.2% and IDU at 11.1%. One significant concern would be the lack of relevant data which focuses on Midtown Emerson community. This community would be better served if the Baltimore City Health Department could obtain data exclusively for this community as opposed to incorporating their data with the presumably Sandtown, Winchester, and Harlem Park communities. Understanding the populations most at risk for contracting HIV and AIDS and the risk indicators that lie within the community will better prepare the community stakeholders, public health advocates, healthcare providers, and politicians to properly allocate resources where they are needed most, beginning with HIV, AIDS, and nutrition education, prevention methods, and in the end, adequate HIV/AIDS treatment. The National Institute of Health, in collaboration with Morgan State University and Ground Roots, Inc., along with several MEC residents, are currently engaged in a census-taking project in order to better assess the needs of the community. However, they currently do not have the manpower to bear the weight of this task. This assessment serves as an initial step to identifying actions and activities needed to improve MEC. It also showed areas of strength in MEC's resources as well as areas in need of improvement, particularly in the areas of rallying stakeholders, collaborative efforts to obtain needed health data, health communication in reference to HIV, AIDS, and nutrition, engagement of policymakers to create reinvestment opportunities, and the development of affordable, healthy food networks. So, on the surface, there appears to be very limited resources in this community to support those with pre-existing diagnosis of HIV and AIDS, or to help with free testing services to diagnose those who may be unaware of their status, to raise awareness to this health issue and educate the community on preventative measures, or to support those in need of drug rehabilitation. However, there are at least 3 hospitals, Bon Secours, University of Maryland, and University of Maryland Midtown campus, in close proximity of this community, which offers some hope as to resources that can be utilized. Also, within and around the Midtown Edmondson community alone are 15 churches that hold the potential to improve health outcomes. Most importantly are the resilient residents who are determined to improve their socio-economic circumstances as well as their environments and health outcomes.